Now join me in welcoming our first speaker of the day, Melissa Lehman, Chief Nursing Officer of Broward Health, Coral Springs.
Morning, everybody. I'm here today with Dr. Osman, our Medical Director of Cardiovascular Services, Dr. Lai, our Chief of Emergency Medicine, and Sandra Bourne, our Regional Manager of Cardiovascular Services. We are beyond excited to welcome you formally to our Cardiac Catheterization Lab, also known as our Cath Lab. And for those of you that aren't familiar with the Cath Lab, it's a special place in our hospital room where we actually, our physicians come in and they can diagnose and treat cardiovascular diseases through minimally invasive procedures. I'm here with Dr. Osman, our medical director, and I would like to turn it over to him for more questions.
Good morning, everyone. My name is Mohammed Osman. I'm the medical director of the Cath Lab here at Coral Springs. And we are very excited to share with you our progress here at Coral Springs Medical Center. As you know, the hospital has been providing service for the community for many years. And so far, we were able to serve our community when it comes to cardiac disease with a certain level of care. That level of care went through a big milestone in the past few weeks. Back in June, as many of you know, we opened a cath lab. It's a specialized unit here in the hospital with very expensive equipment that enables us to do two things. Number one, to provide a diagnosis for certain complex heart conditions. And number two, to provide a treatment through minimal invasive approach. In the past couple of weeks, we have been approved to go to the next level where we can take care of those patients here locally in our community without the need to transfer them anywhere else. So we can provide that level of advanced care right here for our community. This is a big milestone, and I think it will be a great service for the local community here. We are lucky to have assembled a wonderful team, and it's an honor to be part of that team. I have Dr. Lai here. He is the chief of the emergency room services, and he works very closely with our partners with EMS, and he will talk about that part. And I have also Sandra Bourne, who has been leading the team here at the Cath Lab at Coral Springs, and she will also share some information with you. Without any further delay, I introduce Dr. Lai.
Thank you, Dr. Osman. Hello, everyone. Thanks for the opportunity to speak. My name is Gary Lai, Chief of Emergency Medicine here. And, very proud to be a part of this team. Despite the COVID-19 pandemic, our hospital leadership has been able to push through and, get our cardiac cath underway. Amazing team with Dr. Osman and Sandra Bourne, our regional manager. We try to expedite every patient that comes into our emergency department, but, none so more than our cardiac patients, those having heart attacks, those having strokes, sepsis patients. We totally prioritize that, and time is of the essence. We are here to save lives and optimize outcomes. So it all starts out in the field with our partners, EMS, Fire Chief McNally, Coral Springs Parkland, EMS Chief Cardona. We have a wonderful relationship with them. They make contacts with the patient out in the field. They can transmit the EKGs to us right away. We can get in touch with the interventional cardiologist, Dr. Osman, and then we'll be ready and prepared. As soon as the patient comes into the ER, we're able to stabilize them and expedite them through to get their procedure. So very excited with that. And I'd like to introduce Ms. Sandra Bourne, our Regional Manager of Cardiovascular Services. Thank you.
Good morning. Thank you for inviting us to your breakfast. As mentioned before, I'm Sandra Bourne, the Regional Manager for Cardiovascular Services here at Broward Health, Coral Springs. And you can't see my smile, but I'm really excited for where this program is going in such a short time. It was only back in June that we started, and here we are in a position where The patients that usually bypass Coral Springs will no longer have to bypass Coral Springs Hospital with heart attacks. EMS can bring their patients to us and we can care for them. And that's a huge milestone for us. Additionally, whenever a new program starts, one of the things that comes to the community mind is, oh my God, it's new. They don't have any experience. Well, I am proud to say that even though it's a new service for for this hospital, we do have experience beyond. Our medical director, Dr. Osman, this is the second lab that he has opened from the ground up. And he's also been medical director of another facility for years. And so he's got tremendous experience under his belt. And so I couldn't be prouder to be partnering with such an excellent physician. The team consists of nurses and techs who have years of experience. We've all combined, has done thousands of interventional cases, which are cases that we would put stents into the coronary arteries of the patients. So combined, we've got great experience on board, and I am so proud to be part of this team. I joined this team last year, and when I did, I had the pleasure of meeting Dr. Lai. And what a team we've created here at Coral Springs. He's worked closely with the cath lab, and we've just been taking care of the patients in our community. And we look forward to doing that even more so. EMS has been a great part of this, and they've helped us along the way. And so I'm looking forward to the day when that EMS truck no longer bypasses Coral Springs, but actually pulls into Coral Springs with that patient having a heart attack, and we can take them to our cath lab and give them what they need and take care of them. Thank you so much for your time.
As many of you know, we were recently awarded the recognition of the best hospital and also the best emergency room. And we just feel so privileged to have this new cath lab, and we know that this will position us to continue to be the best hospital and the best ER for many years to come. So thank you for your time, and I'd love to open it up to any questions if you guys have.
Thank you for all that you're doing for our community, Broward Health. Does anyone have any questions? Feel free to unmute yourself and ask. Okay, thank you again.
Thank you for your time. We're going to get ready for our next patient.
Great.